Hey guys, this is Healthy Life Designing. I'm your host, Darian Rolls. Today on the show, we are talking about physical therapy. For me, that is a really big thing, and I know a lot of other people out there have experienced plantar fasciitis, back pain, neck pain, sciatica pain, a lot of different things out there that require a physical therapist. And so our guest today is Dr. Junak. He is a physical therapist, and he is also the owner of Peak Physiotherapy and Performance. He's going to be on the show, and he's going to break everything down from corrective exercises, joint manipulation, cupping, and dry needling, and so much more when we come back.
Dagger Law has been part of the Lancaster community for more than 110 years. This is where we live and work. You'll see us at festivals, sporting events, and all around town. We consider our clients as friends, and we walk alongside you through challenging times. Whether you're a growing business, a changing family, facing litigation, planning your future, or dealing with land issues, we're right here. We are local. We are trusted. We are experienced. Dagger Law.
Hey guys, we're back. This is Healthy Life Designing, and we are here with our guest, Dr. Andrew Junak. Hey, thank you for being here.
Thank you for having me.
You made a trip. I know it wasn't very, very short for you. It was a little bit over an hour, so really appreciate you making the drive down. And
not a problem.
One of the biggest things when we first met that really got me excited is a little bit of your history, which one of the first things that I learned was that you played Division I basketball. And that is huge in our household. And so I know we already shared that common interest of health and fitness. Can you talk about that?
Yeah, absolutely. Basketball's always been a huge part of my life. Growing up, I played in high school. I was always super passionate. My actual goal when I was younger was to be a pro basketball player. So the dream kind of started there and then kind of evolved over time. I did play in college. I was a walk-on at the University of Toledo. I had a short-lived college career. I did not play all 4 years or anything like that. I had some different injuries, and some of those injuries actually led me to trying physical therapy. Sadly enough, that wasn't actually what got me completely involved or interested in physical therapy. More so, it was what I was going to do after school and trying to find what a different option was. But basketball in itself was definitely something that has grounded me for a good portion of my life and has helped me a lot with, handling different types of stresses, maintaining fitness, all those sorts of things. So yeah, I'm totally passionate about basketball.
So when did you know that you wanted to go and do what you're doing now? How did that start and evolve?
So once I figured out my basketball career was kind of towards the tail end, I decided to go out and start job shadowing. And I really had no idea what I wanted to do. At the time, I was getting my bachelor's in exercise physiology from the University of Mount Union, and I was definitely confused. I said, what am I going to do with the rest of my life?
Which most kids are at that age. We're still kids, really.
What am I going to do? And clearly basketball wasn't going to be my end result or my calling. So I started to look around and job shadow, and I checked out a number of different professions, spent many hours at the hospital doing internships in different areas, and physical therapy is what drew my interest the most. And I definitely could have seen myself kind of blending the athletic and sports side of rehabilitation and working with athletes just into my daily life. It felt so seamless and so natural for me. So that's kind of the direction that I decided to go. I applied to physical therapy school. I chose to go to Walsh University. That's where I completed my doctorate degree. After finishing that, I went on to complete my residency at the Cleveland Clinic in orthopedics.
And then you've studied in a few specialized areas.
Yeah, so one of my specialties, as I mentioned, is in orthopedics. After completing a residency at the Cleveland Clinic, it gave me a lot of additional education and background, detailed knowledge in anatomy and physiology and how to handle both simple and more complex cases from a conservative management standpoint or physical therapy standpoint. I also was able to get a lot of mentorship from that. So that helped hone my skills in a very short period of time in orthopedics. And the other specialty that I tend to work pretty closely with on a day-to-day basis is vestibular rehab. So I work with patients who experience dizziness.
Right, which I know for myself, I've experienced that multiple times. And what are some of the clients that you see for that? Like, what are their symptoms when they first come to you, and how quickly are you able to help them?
Yeah, so it really depends on the type of dizziness. Many times, patients are coming to me after they've been to the emergency room. And the reason they go to the emergency room is because dizziness is scary.
Yeah.
You're not exactly sure what's going on at the moment. You just know that things are not looking great. So people will go to the emergency room, and then from there, they'll make sure that nothing more serious is going on. And then once that patient is discharged, typically they will find me or come see me. From there, I complete an assessment. And my goal is to determine which type of dizziness that they have. So some types of dizziness are very easy to treat. Other types take a little bit longer. So.
Okay. I think we can get into a little bit about, I guess we'll get into the process. So say that I'm interested in your services and I come into your facility. What are the steps? Like, what are the very beginning steps? We'll have a little bit of time here, and then we'll get more in depth later on. But what would you normally do in the very beginning with a brand new client that want to come and see you?
So the very first thing that we start with is an initial phone consultation, and the purpose of the phone consultation is to make sure that we're the right fit for each other. There are some people who may have been in, let's say, a motor vehicle accident, and if they haven't had any sort of screening or they haven't had any x-rays or imaging to make sure that nothing more serious is going on, we're not a good fit at that time.
Right.
So we need to make sure that the patient's safety is, where it needs to be before we even begin treatment. So a lot of times I'll start with an initial phone consult. We'll go through the patient's goals, what the patient wants to get back to doing, and usually they're calling me because they're unable to do something that they really enjoy or something that they love.
Right.
So we establish what it is that patient wants to get back to. We set goals. I get to know the patient and the condition a little bit more. And then from there, we try to basically take the next step, and then we schedule an assessment.
Right. Okay. And what's one of the very first things? Like, what is your, what are the biggest things, the problems that you're finding with the average person that comes to see you?
Yeah, so the average person that comes to see me typically, I'd say the most common areas that have pain that I typically see are the neck, the low back, the knee, hip pain, and then also people with shoulder pain. Those are probably some of the most common complaints that I get that are limiting people in their ability to move and do the things that they want to be able to do.
And you and I talked, we really got into it when I came to your facility, and we talked more in depth about things and just the limitation in itself for people and what that does, because as a trainer myself, I'll have those same clients are coming to me, and then they stop working out and they think, okay, well, I have this rotator problem, or my knee's been bad for this amount of time, and so says I have to stop all of my exercise and I can't do anything for 6 weeks. Well, then you're stuck, because sometimes people are just getting into their fitness and their health routine, and they're excited and happy and inspired, and then they just stop. Yep. And that's when you come in.
Yeah, so what tends to happen is there's a common misconception that when there's an injury, the first thing you should do is rest. And kind of just put yourself on bed rest and do nothing. But it's definitely a common misconception. And the reason being is because a lot of what I do from a rehab perspective is actually the first thing I do is I get people moving. So there are specific ways that people should begin to move. For example, if you have a shoulder injury and you can't lift your arm over your head, you probably shouldn't be pushing weight over your head if you can't physically lift your own arm over your head.
Right.
So there's a place to start to get you back on that journey to being able to push the weight over your head. But if you were to go home and just kind of do nothing, you can expect nothing to happen or no change. So from a rehab perspective, being able to understand the anatomy, the physiology, what's going on behind these injuries, what causes these injuries, we're able to keep people training during their rehab, so they don't actually have to stop doing what they enjoy, or being active, or hiking, or those sorts of things. We may have to tweak how they're doing it, but inevitably they don't have to stop doing what they love.
Right. And you're kind of this guy that likes to fix the problem. And that's something that I really admired about you when we spoke earlier, because you're taking a little bit more time than the average person to figure out their problem.
Yep.
And you were saying something when we spoke before about fixing the problem. Like, if you're not fixing the problem, you're not doing your job.
Yes. So the way that I look at my job is when a patient comes to me and they say, hey, my goal is to, for example, let's use running. My goal is to run a half marathon or get back to running again. Currently, I can't do it because I have this knee pain, okay? If I'm working with a client and we get them back to going up and down stairs and they don't have pain, to me that's not enough. That's not enough. Their goals were running a marathon. So my job is to take that next step and get them back to running that half marathon at the pace that they want or the pace that they were doing beforehand. And then from there, if their goal is to improve their performance and go faster and have better times, achieve new personal records, then my goal is to take them to that point as well.
Right.
So for me, it's all about getting the outcome.
Right, and that's great. And I think we're going to take a quick break, and when we come back, we're going to get more in depth in how you fix their problems.
Sounds great.
And we're going to talk about the joint manipulation, what that is, corrective exercises, cupping, the dry needling, and we're going to have more when we come back.
Hi, I'm Amanda Wattenberg, Regional Director at Ohio Guidestone. Do you or does someone you know have a substance abuse disorder? Have you been thinking about getting help, but don't know where to start? It takes a lot of courage to ask for help, but it's the most important step you can take. If you think you know everything that's available in Fairfield County, think again. Like other chronic diseases, addiction can be managed successfully. Treatment enables people to counteract addiction's powerful, disruptive effects on the brain's behavior and regain control of their lives. Even if it takes multiple attempts, treatment does work and people do recover from addiction every day. So keep trying because your life matters. You matter, and we're here to help. Call 211 and ask for the treatment resources available right here in Fairfield County.
This message is brought to you by the Fairfield County Adam H. Board.
Hey guys, we're back here with Dr. Andrew Junak, and we're talking things about physical therapy. And we, over the break, we're kind of talking about disc herniation. And can you kind of just open that up to what you do on that side of how you would work with a client that has that issue?
Yeah, absolutely. Disc herniations are actually something I see very, very frequently in my practice. Patients will typically experience symptoms like pain with sitting for prolonged periods of time. They'll have lots of morning pain, morning stiffness. Sometimes coughing and sneezing can even be painful.
Oh, okay. Yeah.
So they might, have this big cough or a sneeze, and it'll shoot pain right into their back. And the reason that happens is because the disc itself has kind of plays a role in pressure regulation. So if your abdominal pressure increases, it can actually put a little bit of strain or irritation to the disc. So sometimes coughing and sneezing, something as simple as that, can be excruciating for someone. And usually bending forward is another symptom that's really, really painful. Typically when I see somebody who has any sort of disc herniation, for example in the lower back, first and foremost, my goal is to sit down with them and figure out, get a very detailed history, so learn about all the symptoms that they're experiencing, what their work goals are. So for some people, if they're unable to sit because their back pain is so bad and they have a desk job, we need to find some modifications so they can go to work.
Right.
And then also looking at what their long-term goals are. Is it to get back to, like in my case, I work with many active adults and athletes. So some of the adults that I work with will say, hey, I want to get back to doing CrossFit. I want to be able to deadlift again. I want to be able to squat again. So my goals for them are to take them that extra step. So they don't just need to be pain-free at work. We need to take them back to deadlifting and squatting. So establishing their goals, and then from there I take them through an assessment. The assessment is looking at their range of movement, so seeing how far they can bend forward, bend backwards, side to side. I check to see if there's any what we call like nerve tightness or nerve tension. Sometimes the sciatic nerve can get very irritated, and people can have pain that radiates down their leg.
Right.
In other instances, we can check the tension of that nerve, and it can actually recreate their back pain, even if they don't have any leg symptoms.
Okay. And I know this isn't something that we talked about before, but it came to my mind because I have experienced the sciatica and the numbness and the pain during my third pregnancy. It was completely unbearable. But do you see clients that are pregnant?
So there is actually another section of physical therapy that is devoted to women's health.
Okay.
I do treat clients who are pregnant, but only within certain trimesters. So usually the first or second trimester.
Okay.
And then at that point, I may refer out to a specialist, depending on what the problem is.
Okay.
But yeah, absolutely. Childbirth and having that baby being pregnant, it does take a huge impact on your spine, and it changes the mechanics of how your spine moves.
Right.
And it can absolutely cause some symptoms like sciatica, really bad discomfort, pelvic pain, things like that.
After you've started with this client, how long? What's the average time frame that they start to, have some? They start to feel better and have more movement and more mobility.
So I would say, to be honest, it depends on how long they have had the problem.
Right.
So the sooner that people get to me, the more quickly that I can make a change. Typically, somebody who comes to me with maybe an acute bout of low back pain or something that just happened, let's say, within the last 30 days, typically there's like a 4-visit time frame on that.
Okay.
To be able to be patched up and back to normal. And again, this is on average. And then at times I also see people who have had a 20 or 30 year low back pain history. And obviously that's going to take a little bit longer because your body's somewhat adapted to the pain. It's used to having those signals. So there's a lot of different things that we need to look at for someone who's had that pain for a longer period of time versus someone who that pain just started or just had an injury.
Okay. What about clients with plantar fasciitis?
Yeah, so plantar fasciitis is kind of a different type of diagnosis. So a disc is more cartilage-based. Plantar fasciitis, there's basically a bundle of fascia that sits at the bottom of the foot and attaches to the heel. Now, that area becomes inflamed, but usually it's inflamed because of a relative weakness directly above the joint, usually in the calf or one of the deeper calf muscles called the soleus. So there can be a tightness or a weakness there. And with overuse, lots and lots of running or cutting, jumping sports, things like that, people will start to feel that pain in the bottom of the heel. And then in therapy, we're trying to basically figure out what the root cause of that is. Are these muscles tight? Are they weak? What is driving that plantar fasciitis to stick around and continue to cause symptoms? Okay.
And what are some of the other big common things that you find?
So disc herniations is a pretty common one. I see a lot of rotator cuff partial tears. I see rotator cuff tendonitis. When it comes to the shoulder impingement, that's another very common thing that I see. For the hips, I see labral irritation, hip impingements, which are also relatively common, especially in active adults and athletes. From an ankle-foot perspective, sprained ankles. I mean, it happens to everyone at some point.
Yeah.
You step wrong, you roll your ankle. Some people need therapy after that, and then others, they kind of spontaneously heal on their own. And then I do see a lot of neck pain as well, disc herniations within the neck, and then sometimes age-related changes as well, like spinal stenosis, where the hole that the nerve is coming out, when those nerves start to go down the arm, the hole gets a little bit smaller, so the nerve becomes a little bit more restricted, and so people can get a pinched nerve from this. So I see a number of different things for all these different body parts.
Right. Can you give us some examples of a client that you would see that you need to teach them some corrective exercises?
Yeah, so that's a great question. Every single patient that I work with is given some form of corrective exercises. The reason being, the corrective exercises are something that they can do at home.
Mm-hmm.
So in essence, they're actually treating themselves when they're
Right.
not in the clinic with me. Typically, I'll provide somebody 3 exercises after each visit. And as the person gets stronger and as their exam or my assessment becomes better and better and better for them, the exercise will get a little bit harder and harder and harder, okay? Because we need to progress them. So
Right.
if something is weak or tight, it needs to be stretched or it needs to be strengthened.
Right.
So from a corrective exercise standpoint, that's primarily what I'm looking for in my assessment, and then I directly tailor that to the patient's needs.
Okay. Okay. And cupping, that's something that I've never done it. I've only seen pictures of it. What is that exactly?
Yeah, so cupping, there's different types of cups. You can have a plastic cup or a glass cup. But essentially what it does is it creates a vacuum on the skin. And that vacuum pulls up on the skin and it causes more blood flow to come to the area. Okay, so think of it as tissue that's lacking blood flow and maybe isn't the healthiest tissue for maybe a chronic injury.
Right.
And then you're bringing new blood to the area with it.
Okay.
Now there's different types of cupping that you can do.
Okay.
So from a dry cupping standpoint, you can have the cup placed on the back and then or a certain spot, and you can leave it there for 10 to 15 minutes. This is probably the type of cupping that most people are familiar with, where you'll see the different spots on people's arms or their back,
Right.
especially with professional athletes. I also do a different type of cupping, which is cupping with like what we call like a mobilization. So I will put massage cream down, I will create the vacuum seal with the cup, and then I will actually move the cup around to help basically
Pull more circulation.
And sometimes I'll even have the patient move with the cups on them.
Oh, okay.
So if the cup is on their shoulder, I'll have their shoulder do different movements that would be
Okay.
therapeutic,
Right.
and then help to better restore even more blood flow to the area.
Okay. And the dry needling.
Yeah, that's one of the most common ones that people always ask about.
Yeah.
They hear dry
It's very
needling.
intimidating.
Yeah,
I don't
people-
like needles anyways.
Exactly. People hear the word needles, and some people panic, and then some people they're pretty comfortable with it. The nice thing is out of all these treatments, these different things that I do with patients to help heal naturally, none of them, aside from probably exercise, are must-haves. So if somebody comes to me and they say, hey, I'm afraid of needles, it's not a big deal because I have several other techniques or different things that we can do. We still have cupping or joint manipulation and exercise at our disposal. So if all I did was utilize needles in my practice and somebody came in and said, hey, I'm afraid of needles, we probably wouldn't be a good fit.
Right.
So the good news is that there's many other options, but essentially what dry needling does is we look for those tight muscle knots or bands of tissue within the area that hurts. So if somebody has a rotator cuff problem, then I'm looking into those rotator cuff muscles and I'm trying to find that tight muscle knot or that band of tissue that feels similar to their pain. And at that point, I'm taking a very thin, it's called a monofilament needle. So it's extra thin, there's nothing being injected, there's no fluid inside of the needle. And I will actually take the needle and I will try to hit that muscle knot.
Okay.
And essentially what that does is that also creates more blood flow to the area.
Okay.
But unlike cupping, where cupping is very superficial, it only pulls on the skin, the needle actually goes through the skin and can get into the muscle tissue itself.
Okay.
So we can have a little bit more direct effect with dry needling
Okay.
as far as tissue healing and helping people recover from
But it does
injuries.
the same thing to the muscle. Once the needle is at the muscle,
Mhm.
it's creating the same effect.
A similar effect.
Okay.
There's still some things that we don't completely know about dry needling that we're still learning, but one thing that we do know is it's great for short-term pain relief. And if you can hit one of those specific spots or those muscle knots, what we find on repeat visits when we see the patient next is that spot is not nearly as tender anymore and their pain levels have been reduced. So it's one of those, it's a great modality to use in conjunction with some of the other things that we do at P3.
Right. And joint manipulation. Can you talk about that?
Absolutely. So there's a lot of different thoughts and ideas around joint manipulation, and everybody's familiar with joint manipulation and adjustments or feeling the pop. That's kind of the most common thing.
It's what you think of when you hear it.
When you hear it, you're like, oh man. And people usually associate that pop with a relief of pain. So joint manipulation is also a fantastic tool. I use it in my practice pretty much daily to help clients relieve pain. It works great in the short term. What that pop actually is, because that's such a common question that I get, is it's gas bubbles being released. So so pressure actually builds up within the joint, and then when a quick technique is performed to the joint will pop, and then you'll feel a release. So the patient ends up feeling an endorphin release, and they get pretty quick or immediate relief. Now that relief can last up to 24 or 48 hours. So that's why it's such a great tool to use, especially to get people fast relief. And that pop, whereas back in the day we used to think that the pop was actually the joint adjusting or changing place.
Yeah.
What we know now from a research perspective is it's just pressure being released. So it's kind of liberating, because we used to think that we had to continue to move joints a certain way and put them back into a specific place because they were out of alignment and things like that. But now from more contemporary research, we kind of know that that's not always the case.
So could you give an example of a client that you've performed that on?
Yeah, so sometimes a client will kind of stick with the low back pain example. So a client comes in, has low back pain. It doesn't seem to be very disc related. There's no nerve irritation. Symptoms are not very irritable. That is a great person to perform a joint manipulation on. Somebody where it's not such a good idea is somebody with maybe their whole leg is numb after a really bad bout of back pain, because you do run the risk of doing a very quick maneuver, and it could aggravate the symptoms.
Right.
So somebody with low irritability who's lacking some mobility within a certain body region, that's a great candidate for someone who could benefit from a quick technique to loosen up that joint.
Right. Is there any other examples that you could give of anything that we haven't talked about yet that you would like to share?
I think the biggest thing that I'd love to hit on is kind of the philosophy of what we do here at P3 at Peak Physiotherapy and Performance. We focus mostly on getting people back to doing what they love. And I know that sounds super broad, but the idea is when you go to some other or many other medical providers, their goal is to get you back to function in daily life. But function in daily life doesn't always equal happiness. There's some people, especially a lot of the people that I work with on a daily basis, they can do everything in their daily life just fine. But what they're not able to do is throw a ball outside with their kids,
Or go up the stairs.
Maybe they want to do a lot of gardening, but their body, they can garden maybe for 15 minutes, but after that they start to have pain. They want to be able to garden and not have restrictions. They want to be able to go to the gym and hit a new personal best on a lift. They want to be able to run a marathon. Their goal was, maybe to even just do a 5K, but they're not able to do it for that long. They can walk without pain, but they can't go, 5 kilometers. So,
exactly.
The biggest thing is that we focus on getting people from not only from pain to pain-free, but pain back to doing what it is they want to do with their life.
Everyday living.
Everyday living.
You just want people functioning. You want to fix the problem so they can function and perform their daily activities without pain, which is a great gift to have because I think we all experience pain at some point. But I really appreciate you making the trip down here and kind of helping everybody understand these things and what you offer. And I personally really hope that this inspires people that are watching to put yourself first and know that there is a solution to the pain you might be experiencing, whether it's in your back or your knee. And if you have student athletes or you're really into fitness yourself and you're stuck just because of a body part not doing what you want it to do, check this guy out. Maybe he can help fix your problem. Can you give them the information to find you?
Yes, so the best way to get started with me, if you're interested in scheduling an appointment, would be to either call the clinic at 614-467-0285. Another option is you can go onto the website at www.p3physio.com. And at that point, you can fill out a contact form, and then I will give you a call within the next 1 to 2 days, and we can get started.
All right. Thank you so much for being here. Hopefully you guys enjoyed the show. That is all that we have today, but we will see you soon.